Hi guys, welcome back to our channel. So, for today, I hope all of you are safe during this pandemic. And also for today, guys, let's talk about nurse management during dialysis. So, ano ba yung mga complications? Here are some of the complications when you are dialyzing a patient. The hypotension, yung muscle cramping, yung itchiness, yung hypertension, um, fluid overload, tapos nagno-nausea or vomiting, tapos nagdi-dizzy yung pasyente. Those are most of, common complications during dialysis. So let's go first to hypotension. So yung hypotension guys, yun yung mababa yung blood pressure nila. So before I start pala guys, these are my own ano ba yan? Ito yung mga things na learn ko when you are dialyzing a pasyente. Siyempre, kung you are new, you have to share it to others also para those who are aspiring dialysis or nurses that wants to be the dialysis nurse. So feel free to watch and learn. And then if you have any other those sa mga veterana, please share your insights so that I will also learn from you guys because every day it's our life is a continuing education, man, guys. It should be a continuing education for us. So, okay, let's go back. So, guys, hypotension, of course, hypotension, mababa yung blood pressure. So, what are we gonna do during dialysis? So, pag yung pasyente nag-hypo, of course, if they are symptomatic, um, yung goal nila is like 3,000. So why can't you just lower the goal para matolerate ng pasyente? And don't wait for you to lower the goal. Kasi there's a tendency, pag hindi mo ni-lower yung goal, guys, ito yung nakikita ko. Pag hindi mo ni-lower yung goal ng pasyente, halimbawa 3 liters yung i-remove mo sa kanya. Pag hindi mo yun ni-lower, tapos nag-hypo na yung pasyente, there's a tendency na mag-hypo siya ulit at hindi niya marirecover or yung blood pressure niya is, it will be hard for you to make his or her blood pressure go up pagkatapos ng dialysis. So, yung precaution mo is that lower the goal at the start na nagtitrend na yung blood pressure niyang na mababa na. Para you have to avoid giving the patient, what do you call that one, normal saline. Kasi pag mababa yung blood pressure niya, tapos magsisymptomatic hypotensive na siya, yun, of course, bibigyan mo na siya ng saline. And then, paano kung yung pasyente ayaw niya ng saline? So, what will be your best course? So, of course, you have to put the patient to Trendelenburg position. Tapos, i-turn off mo yung pooling, and then pag turn off mo yung pooling, so it means to say hindi ka nagpo-pull ng fluid. So there's a tendency that the patient will be fluid overload pag umuwi siya ng bahay because of the hypotension during dialysis. So, ang dami mong ibabalanse pag ganito yung pasyente, ganito si pasyente, or parang ganyan. So, if you wanna be pro, then you have to think ahead of time that, oh, itong pasyente prone to sa hypotension during dialysis. So, I have to calculate kung how many liters of fluid do I have to pull since day one para hindi siya mag-hypotensive during dialysis. And sometimes, guys, kung hypotensive yung pasyente, try to ask if uminom ba siya ng gamot para presyon niya, or Did she take pain medications prior to dialysis? And you also go back to the labs, especially the hemoglobin. If the hemoglobin is low, so there's a tendency that the blood pressure is also low. Kasi syempre, yung pasyente is anemic. And then, when the blood pressure is like that also, when it's low, try to check the blood sugar. Baka kasi yung blood sugar ng pasyente is mababa, so nag-hypo na siya. And then, if symptomatic, yung blood sugar niya is mababa, then that's the time that you have to give D50 for the blood pressure to go up, but you have to ask the doctor's order. But in chronic setting, there's already a standing order that you can give that D50 if the blood sugar is below 70. Symptomatic or asymptomatic. That's a standing order. Hello. Yeah, beautiful. And then, after that, um, first, let's go to the hypotension. Pag hypotensive, asymptomatic yung pasyente, lower the goal para hindi mabilis yung pooling ng tubig sa katawan ng isang pasyente. But, I swear guys, if you lower mo yung goal ng pasyente, I'm pretty sure that the patient will really tolerate whatever you are going to pull on that certain time. Kasi hindi siya mabilis yung tubig per hour na i-take off mo sa pasyente is not too much for her body para magko-compensate yung dalawa guys. Hindi siya too much fast at hindi siya gaano karami na ipupul mo sa katawan ng isang tao. So hypotension symptomatic, place the patient in Trendelenburg position and then bigyan mo ng saline like 100 cc and then turn the UF off and then you do the documentation every 15 minutes to see pag 80s, 70s, 80s, blood pressure mo is every 5. Blood pressure checking should be 5 to 10 minutes so that you will see na nag-i-improve yung pasyente. Nag-i-improve yung blood pressure ng pasyente. But if it's in the 90s, 100, then do it every 15 minutes. And then, if nag-improve na yung blood pressure ng pasyente, then you can do the blood BP monitoring every 30 minutes. So what will be your intervention also? Pag yung pasyente is always hypotensive every treatment, then you have to recommend to the kidney doctor na, hey doctor, are we gonna change the dry weight, estimated dry weight of the patient because the patient's blood pressure has been dropping every treatment. So that way, by the week, next week's treatment, tignan natin kung imo-monitor natin yung trend ng blood pressure ng pasyente, if it's still dropping or is it improving. Then we go back to the blood pressure medications of the patient. I recommend mo din yun sa doktor. Don't be hesitant to recommend something to the doctor because the doctor don't see the patient every day. It's you who sees the patient, who takes care of the patient every single day. So you are the second doctor of the patient's doctor. Am I right? So number, be open. You have to speak up guys kasi other doctors are very intimidating. But if you stand on your own and if you know what's going on with the patient, then why bother to be intimidated by somebody who doesn't see their patients every day? So yun guys. So what are the interventions? Again, the other interventions sa low blood pressure. Check the dry weight if it's right. And then check the blood pressure medications para ma-readjust yung blood pressure ng pasyente. And then try to check yung hemoglobin every week. Kung mababa yung hemoglobin, then you have to check the hemoglobin every week para makita kung the patient needs a blood transfusion or what, or ano ba yung intervention for that patient. So that's it. Let's go to the second complication during dialysis. It's the muscle cramp or the cramping. Ito yung it's this is really common, guys, during dialysis. So yung pasyente nagka-cramp in the mid, like sa kaligitnaan ng dialysis. Usually mga 30 minutes before the dialysis end, yung nagka-cramping na yung mga pasyente. So bakit nagka-cramp? Kasi it's either yung pulling natin is very fast or the patient is too dry. So when we say too dry, there's nothing to be pulled from the patient. So walang tubig na mapupul. As in pigang-piga na yung pasyente. And also, what you're gonna do is you have to of course turn off the UF or lower the goal, then normal saline, give normal saline, then applied pressure, but don't massage the affected extremity. But kasi, why not? You just have to apply the pressure. Something, if this is your body and then it's cramping over here, just put the pressure on it, or like this, but never massage because you don't know if the patient has an air embolism. Oh, no, not air embolism or a blood clot. Sorry. If the patient has a blood clot in his body and then you massage it, it will go somewhere else that will cause cardiac arrest. I learned that one, guys. So muscle cramp, see, you have to readjust the dry weight and then normal saline or turn off the UF, no pulling, or lower the blood flow rate. Baka kasi mas mabilis yung pulling ng pasyente. If the patient is an easy pull, yung easy pull is like nakukuha ka agad-agad yung tubig. So, there's a tendency na magka-cramping talaga yung pasyente. So, how about the itching? To yung mga itching, guys, marami to. What will be your nursing management to this? So, yung pasyente, pag nag-i-itch, we have to, if it's the first time, start to check baka may allergy yung pasyente sa dialyzer or may reaction siya to something. Try to check if ano ba yung kinain niya, i-assess niyo kung ano ba yung, do the assessment. Ano ba yung kinain niya, may medication ba siyang tinake na nag-cause ng itchiness? Or try to check if the skin is really too dry, na nagsiscaly na siya. Try to check it and recommend to the patient na, hey, Nay, Tay, you need to put lotion on so that during this cold weather, it will not be too dry for your skin. And then, try to check the phosphorus level, guys. Kasi pag mataas yung phosphorus, there's a tendency na nag-i-itch talaga yung pasyente. No. Encourage them to take their binders as well. And then, ano ba yung inaan mo dito? Itchiness. Yun. Adjust mo yung dry weight. No, not dry weight. But adjust your goal. Then, normal saline. And then also, guys, recommend this to your kidney doctor now. Doctor, the patient has been complaining of itchiness during dialysis. Is there a way that we can change the dialyzer just to make sure that it's not the dialyzer that is affecting her itchiness? Or the doctor can recommend Benadryl or anti-itch cream or anti-itch medication or something like that, guys, you know? So that will be your intervention. And then you evaluate the patient the next time that you will see him. to see if nag-workout ba yun or hindi. So, let's go to the the fourth one, the high blood pressure or hypertension. So, ano yung intervention natin pag ito yung blood pressure nito is like 180, 190, 200. Of course, pag 200 na yung blood pressure ng pasyente, pre-assessment, you have to call the doctor. But before calling the doctor, you have to ask the patient, hey, did you take your medication prior to your treatment? Of course, pag sinabi na hindi, pag sinabi na oo, so you have to tell that to the doctor, hey doctor, the patient's blood pressure is above 200. So do you want us to dialyze the patient or send him to ER? Para to prevent stroke, guys, stroke, chest pain or arrest or something like that. And also, sinabihan mo yung doctor na, hey doctor, the patient took the blood pressure medication like 5 or 10 minutes ago. So can we dialyze the patient? Of course, if may okay or go signal yung doctor, then make an order for that saying it's okay to start the treatment per doctor's order. So you have to cover yourself also. And then if the blood pressure, so when you dialyze the patient, no, in you started the treatment of the blood pressure. You started the dialysis of that patient, and after 1 hour, the blood pressure stays like 180, 190. So what are you gonna do? You have to give the patient clonidine or a medication that will drop his or her blood pressure. And also, don't put the patient in Trendelenburg or supine. Just put the feet of the patient down so that yung dugo niya diretso lang sa paa. Hindi siya pupunta dito para mag-avoid tayo ng stroke or any discomfort for the patient's head. So yun guys. And also, try to check the weight gain of the patient, yung intradialytic weight gain. Yung sinasabi nating intradialytic weight gain is yung ginain niya in between treatments. So yung pasyente has like 4 kilos, 3 kilos, 5 kilos since the last treatment. Of course, yung blood pressure niya is mataas kasi hindi siya nagpipipi. So yung pressure sa loob ng katawan niya is really, really high. So you have to expect that also. So yun, medication, clonidine, give something for that. Or if the patient can tolerate pulling more, like for example, he can only tolerate like 3 liters for a certain treatment, why can't you just challenge it by half a kilo, like pulling 3.5 liters instead of 3? So in that way, you are compensating the patient's weight and the blood pressure also. See? So it's a win-win situation for the patient. Not for you, but it's all about the patient's health also. So anong ginagawa natin sa fluid overload? Oh, let's go back to the high blood pressure. So for the high blood pressure, guys, so what we're gonna do for this also is to adjust the dry weight. Because there's a tendency na may tubig pa sa loob ng pasyente. Kaya yung blood pressure niya is mataas. So we need to readjust or lower the lower the dry weight to see if yung blood pressure niya is mag-i-improve the following week. So, makikita mo yung difference. Okay pala yung blood pressure niya pag nilower natin yung dry weight. Pag tinaas mo naman, it's not good. So, you have to reconcile the medication of the patient, the blood pressure medication. I-increase, of course, the doctor yung medication to see kung saan ba yung mas mabuting medication for him to take. Then, yung dry weight niya, ilo-lower. Tapos, be compliant to your treatment. That's it, guys. So how about the fluid overload? So what will be your intervention for this? Of course, you have to educate the patient. Educate mo na dapat 1 liter lang yung iinumin niya in between treatment. Of course, we cannot avoid that because there are patients that are diabetic. And when you say diabetic, patients are really prone to drinking because they're always thirsty. And what you can do, there are patients are really stubborn, and you have to tell them that, hey, you show to them the bags of water that they are intake, that they are taking in. Like yung saline ng bag, ipapakita mo sa kanila na, hey, these are the bags of water that you are drinking each day. I mean, since Monday. Yun. Kung 5 liters yung na-consume, yung 5 liters yung gain niya, weight gain niya since the last treatment, ipapakita mo sa kanya para he will feel guilty that he was drinking too much over the weekend. And also, um, you have to educate them to eat food less in sodium, food that are salty, because they said that when you eat lots of salt, the water, you will crave lots of water also, which is true, right? Yan. And what else are you gonna impart to the patient for fluid overload? Um, if they cannot be able to, if we cannot be able to remove a certain amount of, I mean, those weight gains that he or she had for that week, then offer an extra treatment. Tell the doctor that, hey, doctor, can we do an extra treatment for the patient so that we will avoid um, any complications regarding about fluid overload. And guys, so how about the nausea and vomiting during dialysis? Yung nausea and vomiting are usually like symptoms of hypotension or high blood pressure. Hypotension, low blood pressure. Hypertensive, high blood pressure. So it's either of the two, or may nakain lang yung pasyente na hindi swak sa kanyang tiyan. Or if the patient is diabetic, of course, the patient will have nausea and vomiting. And sa hypotensive naman, of course, they will have nausea and vomiting, clammy skin, and then they feel that they want to go to the bathroom. Try to check their blood pressure if it's low, because those are the symptoms that your patient is having low blood pressure. And also, when you have high blood pressure, of course, they do have chest pain. I mean, not chest pain, chest discomfort, and then headache. Then their back of their neck is also aching. They have this pain radiating from the heart all towards the back, and then their left arm is also aching. So watch for those kinds of symptoms, guys. For nausea and vomiting, what you can do is give saline. Don't pull anything, lower the blood flow rate, and give Zofran. I don't know what's Zofran in the Philippines, but Zofran is an anti-nausea medication. Yes, guys, it's an anti-nausea medication, and that is really good for nausea and vomiting. And also for that, you have to document every 15 minutes. If no, not actually every 15 minutes. Oh, yes, every 15 minutes to see if there's an improvement of the patient's health, and then you assess the patient after 30 minutes if the Zofran um, makes her feel better. And also, what else? What else do you want to know, guys, about the complications of dialysis? If you are a dialysis nurse, please do comment, and so that I will know what else to do. Education is a continuing process. Each day that you are, ano ba dan, guys? As I've said, hindi naman nagtatapos yung education mo when you get your credentials, but every day is a learning process. And whoever know this or whoever watch this, please do comment so that I will know and I will implement that one and my experiences. So, guys, thank you for watching and stay safe. Please do thumbs up and let me know what do I need to do next time so I will know what will be my content next time. Ciao, have fun and be safe. Bye bye. Huh? No, not classes. It's